standpoint, can you tell us where people can get more up-to-date information, what they can look at every day instead of going to these giant news outlets that really just want to generate them to stay on the TV all day and generate ratings, right? And put that little scare factor in, which maybe some people do need to be a little more scared, but where can they get more up-to-date information?
Well, a place they can go that doesn't have a lot of link bait on it would be, let's see, oakgov.com/health. And that's our main page for Oakland County Health Division. And it's easy to get to our dashboard for numbers within the county and resources and that sort of thing. And again, Shane can provide the nurse on call number, which is, I think, a fabulous resource when people have questions and, for example, don't have access to the internet.
Yeah, and so our nurse on call, 1-800-848-5533. We also have an email address, which is noc@oakgov.com. That's oakgov.com. But in addition to our website, oakgov.com, and there's a big red button for COVID-19. If you simply go there, and you could get to our dashboard, you could get to our map that we have for infection rates in Oakland County to see where it's most prevalent. And again, remember, it's widespread in the community. So if you're in a lower prevalent part of Oakland County, don't think that you're safe. But you can also go to michigan.gov/coronavirus. And they have a wonderful dashboard. They have wonderful information at a statewide level. And they've broken down a lot of the data by cases as far as age group percentages of people hospitalized. And they're trying to push as much solid information out there as possible. The CDC's page, cdc.gov, is great for national information. But I'll be honest with you, it can be hard for a normal person to navigate. There's just so much information on there that it's a little bit like reading stereo instructions. Unless you know exactly what you want to go in there and look for, it's pretty difficult to just peruse for light reading. And also,
it changes regularly. It changes, it seems like, on a daily basis as their policies and advisories and guidelines change, which can be frustrating.
Right. So if you're looking at it, know what you're wanting to find, go and find it. And a lot of the data on the CDC's page is always a step behind that particular state's information. So if you want to know about Michigan's information, you go to Michigan. If you want to know about Oakland County's information, you go to Oakland County. The information is just slower to filter up to the national institutions like the CDC. So those are great, solid websites. They are just have slightly different purposes for each one that you want to go to.
Thank you. We really appreciate you guys coming on and answering some questions. Do you guys have anything else you'd like to share with the community?
Ignore those suggestions early this week that we have already reached the peak and are on the far side. I really, really want people to avoid gathering for this holiday weekend. I will say this, fortunately, the governor and Dr. Caldoun received the message that is the wrong thing to tell our communities right now. And in fact, we have not reached the peak. We haven't reached the peak in Detroit, in Oakland County, in Macomb County. We are still adding cases every single day. I'm not sure where that little rumor occurred on Monday or Tuesday, but that is really a disservice to the effort to self-isolate, socially distance, continue being locked down, so that we can put an end to this. If we can prevent people from bringing, especially family members in from out of state or from distant towns and villages in state, and gathering for this holiday weekend or over the next week or so, I'm confident that we can get to the peak and down the far side, and we can get through this. We really want to avoid kind of the second peak anytime soon. We need to get past this. So I want to beg people not to bring relatives in from out of state for this holiday weekend.
Something, it's really interesting, Dr. Faust. I was thinking the exact same thing, and it's because I'm somewhat active on social media in my own personal circle, and I've already seen it start to happen. I've already seen a few posts about an article here or an article there where it's time to start loosening up some of these restrictions. Oh, this hospital didn't get used as much as they thought it would. Can we just open it up? And that conversation is already started. And that's the conversation that's the most, because right now, during the most infectious period of time, is the hardest part for our healthcare providers. However, the hardest part for the rest of us is going to be after we get past that peak, whenever it is to continue to do the social isolation, because the immediate threat is going to seem like it has passed. And there's going to be a lot of social pressure. There's going to be a lot of political pressure.
Yes.
Start opening things back up. And that is worrisome. And that is what is going to be the most difficult conversation for the rest of us to do. And so anybody who is watching, your audience, it's important for them that when they do get to that point, when we do get to that point, is that they remember the fight is not over. It's just moved on to a different phase.
Thank you very much. And I think from a nursing standpoint too, all of my friends that are still in hospitals working in ICUs, I mean, they're feeling the brunt of this. They're picking up extra hours. They're killing themselves to make sure that your family members, remain safe and healthy and kind of continue them on, or if they're in the ICU, to support them through this time. So really, from a nurse too, we're begging you, stay home.
Thank you.
Yes. Maggie, you want to wrap this up?
Yep. Thank you, gentlemen, for all of your insight and this great information. This will be going out to the community, and hopefully everyone listens. I thank you for all of your good information, and the community does as well.
Thanks for all you do.
Appreciate
Thank
it.
you.
Glad to have the opportunity.